speaker and our guest of honor for today, that is Dr. Deepti Bahl, who is an MBBS and obstetrician and gynecologist, and also an academician and mentor for NEETPG and PG resident teaching and NEETSS, and also the director at Delhi Academy of Medical Science. I wholeheartedly welcome you here on this very medical conference that we are doing for the very first time in 2022. One of the largest medical conference, virtual conference by Federation of Medical Students Association, sponsored by Delhi Academy of Medical Science.
Hi, Alicia. Thank you so much for having me here. It's an absolute pleasure to interact with you, to interact with students, and to give my 2 cents on how they can work better and achieve more.
Thank you, ma'am, for taking out precious time and sharing about how to study effectively in MBBS, because staying happy is definitely one thing, but we also have to study, and to study in an effective manner is something very difficult. You know, people study for 6 hours, but that's not effective. You need to study 1 hour, but you need to be focused and concentrate for that 1 hour. So I am sure students are going to learn a lot of new ways to study effectively. So over to you, ma'am.
Right. So thank you so much, Alicia, once again, and very truly said that, you know, a lot of us put in hard work in terms of number of hours, but not each and every one of us is able to convert it into, you know, a success that we dream of. So, you know, you have to understand that whenever you're working, your main goal has to be set, and you have to sort of understand why you are doing something. So today I'm going to talk about how you can study more effectively during your MBBS, so that, you know, you are not only doing well in your professional exams, but at the same time you are getting ready for your postgraduate entrance exams, and also at the same time you are trying your best to be a good doctor, someone who has good knowledge, someone who can put their knowledge to application, and yet at the same time, you know, understand the patients, be compassionate. So there are a lot of aspects of success, and you know, I'm going to cater to some of them today, because we are precisely going to talk about how effectively to study during MBBS. Now, you know, to start off, I would simply say that over a period of last 2 years, we have seen a lot of transition, evolution happening in medical world, especially in terms of postgraduate entrance exams, right? And the big change that we see now is that we are moving away from rote learning, and we are moving more towards integration. We are moving more towards concept building and concept application, and connecting the dots of medical science. So irrespective of what exam you're going to appear for, so we're going to talk about that, but irrespective of that, one of the most essential things for you know, becoming your better version as a doctor and to achieve you know, good ranks as far as your entrance exams are concerned is having a very good theory base, having a good content building while you are pursuing your MBBS. So what are the key ingredients that ensure that you are having a good content, not only in terms of, you know, you have it with you, but you actually know it and you are able to apply it as well. For the first instance, I would say that, you know, the government keeps coming up with, you know, changes that they're going to bring forward in medical education. And one of the things that we are aware of is changing of NEETPG exam to next exam. Although we are not really sure of when it is going to happen, but so far the news that we have is that the MBBS students who have started their MBBS course in the year 2021, right? So people who started doing or pursuing their MBBS in the year 2021 would be the first batch to appear for next PG. And till then, it is going to be NEET. So this is what we know so far. So students who have joined MBBS last year, students who are going to join MBBS this year, for you people, it is going to be next exam. And what we know also is that next exam is going to have 2 or 3 components to it. So maybe next 1, next 2, and next 3, right? So what is put forward is that next 1 is going to happen at the end of second year, and it will ask content from first and second year subjects. And next 2 would happen at the end of final year. And next 3 will probably happen at the end of internship. So out of these 3, next 1 and next 3 are probably only as a pass-fail exam. So you would not be given any ranking or marks in it. But next 2, which is going to happen at the end of final year, will have a scoring system as well. So the same score would tell you whether you have passed the exam or not, because you need to have some minimum marks in order to qualify the exam, and you will get a degree as an MBBS graduate. But also the same marks will be eligible to gain entry into postgraduate training programs. So that is the broad outline. Now, what is the implication of such a system that is going to happen? And how are we supposed to, match up to this? So, the first thing that comes to my mind is to tell you students that a lot of times when we join MBBS, we think that, abhi to aaye hain, so let's enjoy the first year. And half of the first year only goes by in the aura that, oh, finally we've entered a medical education or MBBS program, and we're going to be doctors, and you're all in euphoria. And that is how it has been for us as well. So, we know this because we've been through the same phases. So half of the first year just goes by in this excitement that we are going to be doctors, right? And in the second year, your seniors would keep telling you that this is sort of the honeymoon year of MBBS. You can enjoy, you can have a lot of fun, and don't think about studies too much. There's no doubt there has to be a balance between enjoyment and, your studies. And definitely they both play an important role in bringing out your personality, in maintaining your mental health. But nonetheless, we have to understand this, that unlike NEETPG, which is actually held at the end of internship, next 1 and next 2 are going to happen earlier. Yes, so we are going to have less time to prepare for it. And the sooner we start, the easier it is going to be for us. Let's understand how. So if you start earlier, you don't have to slog for long hours. All you have to do is, number 1, maintain consistency in your work. So this is my first advice when I talk about effective study in your MBBS, is consistency. Now, what do I mean by it? I'm not going to tell you to study for 12 hours, 10 hours, 8 hours, right from the first year of your MBBS. What I would simply say is that right from first year of your MBBS, why not start putting in some consistent hours of work? They could be as short as 2 hours, 3 hours, or 4 hours, depending on your capacity and your upper limits. But consistency is the key. It keeps you rolling. What happens is you divide your big work into smaller tasks, and that becomes more doable. और उससे क्या होता है, when you have shorter targets, you're able to achieve it, and it pushes you to give yourself more targets, and it also pushes you to stretch your limits. So the first take-home message is consistency. Yes, right from your first year of studies as an MBBS graduate, ensure that you're consistent with your work. That will make it easier. The second advice is, whenever you are reading, you have to read with 3 things in your mind. Number 1, whatever I'm reading, definitely I have to pass my professional exams, but I also might have to give next 1 if I'm currently a first year student. As I said, people who join in 2021 and 2022 would have to appear for next. So, I have to appear for next. The second thing you have to keep in mind is, exams aside, I have to be a good doctor as well. And a good doctor needs to have a good base. And your first and second year subjects form the base of your, I would say they form the framework where you build your career, right? As a doctor. So please ensure that whatever you're reading is not just to crack exams or to pass exams. It is for your own confidence. It is for your own betterment. And, it is for good to the patients as well. So you have to remember that always. And when I say that, I would say that try and read standard textbooks right from the beginning. You should read good books. I know these standard textbooks are a lot of times voluminous, and you would have smaller versions of same books, and they're very tempting to do, right? Because you feel you'll be able to do it in a shorter span of time. It'll be faster, and you might be only able to read it close to the exam. But I think this is a myth. When you try and cut short on your work in order to do it faster, what you are compromising on is quality, right? So always, right from the beginning, read standard textbooks. Also, when I say that, I would like to reinforce that when we say you have to read standard textbooks, you must read it in the corresponding year. Yes, for example, if you're in the you're a first year MBBS student, you should read standard textbooks of first year subjects. Similarly, like read Ganong, read Guyton, these are good textbooks to be read. Okay, if time permits, you should read Harper's. We did study Harper's in first year MBBS when I was in Lady Harding Medical College. Yes. The second thing what I would say is when you are in second year, ensure that you are reading Robbins. It is an excellent textbook. It will help you remember your medicine. It will help you remember surgery. It will help you remember oncology, obs and gynae. So, every clinical subject has its essence in Robbins pathology. So that is again a textbook that you must read. Okay. Similarly, for PSM, Park is very important. Similarly, when you land up with your final years, you have to read some parts from Bailey and Love, especially the general surgery aspects. You would have to read certain parts from Harrison's. So reading good textbooks is very essential and should be a part of your curriculum. Do not cut them out at the cost of, convenience, I would say. Okay, so don't give convenience a priority. Don't give easy a priority. Okay, so read good books and read them in the corresponding years. The third thing I would say is we read standard textbooks, but I'm sure you all would agree that reading them again close to the exams is going to be very, very tough, whether it is your professional exams or whether it is your entrance exams. So once you've read your standard textbooks during your first year, second year, third year, or fourth year, it is also very essential at the same time that you have your own set of handwritten notes. That is something that you can keep going back to year after year, right? So whenever you are attending classes, you must ensure that you are writing things by yourself. It has a great impact on your memory. It also helps you to connect dots. It helps you to retain longer and retain more, actually. And as I said, if you have your own set of handwritten notes, you can do things multiple times at a much faster rate. So these are the three aspects that are very important. One, remembering that I have to clear exams, the professional exams, the next exam, or the NEETPG exam. Second, remember that I have to read good books because eventually I have to be a good doctor. I have to learn my concepts. I have to be very strong with my basics. And third, you must get into a habit of making your own handwritten notes. Yes. Also at this time, I would like to tell you that, we at AIIMS try and cover up all three aspects for you. So we've launched the first year tuitions as well. We've launched second year tuitions as well. And because of the change in the curriculum, when we are teaching you in these first year and the second year tuitions, we are teaching you from standard textbooks. We are converting it into an easier language with which it is easy to write your own notes and also read them multiple times. Third, we are going in depth. So this is also something that you must understand, that the current pattern of exams, they are all in depth. So you have to be very rich with your theory content. Superficial knowledge is going to help you only up to a certain point. But beyond that, you find yourself confused between options in case the knowledge is not in depth. So yes, you have to study in depth. So the best way is starting early, doing short hours, but being consistent. So if you start in your first year itself, you can manage by even doing 2 to 3 hours of study every day. Read good things, make your own notes, and have your time out as well, to watch a movie, to go out with friends. So you have to strike a balance where the end result is you being happy doing what you really wanted to do. So you always wanted to be a doctor, right? And that's why you are here in this profession. And temporarily it feels that we want to be doctors and that's it. But no, you are people who are seeking a higher impact in your life. I'm sure many of you have already thought that you want to super specialize into cardiology, into GI, into oncology, into surgery and whatnot, right? So we are people seeking higher impact, where we are able to touch more lives. So for the greater good, we have to learn the art of splitting our work into shorter things, short targets, very well-defined targets, because they're more doable, and then being consistent with it, going step by step. It makes your journey easier. Now, as I said, the next aspect that I want to take up is integrated learning. So this was the starting point where I wanted to put across the 3 most important ingredients when you start your MBBS. The next important point that I want to put across is integration, right? So currently, you would see, if you ask your seniors and you see the pattern of questions being asked in your various entrance exams, so-called NEETPG and the most recently held INICET exam, which is an exam for the institutes of national importance. It includes institutes which are called as central institutes. So it includes AIIMS, all the AIIMS. It includes PGI Chandigarh. It includes JIPMER. It includes NIMHANS, right? So they've all clubbed under one name, that is INICET, Institutes of National Importance. So currently, there are 2 exams being held. One is INICET and one is NEETPG. So INICET is what is held twice a year. So one session in May, one session in November. And NEETPG is held once a year. Usually it is January, but over the past few years, it's been happening in March because of the change in curriculum. So, but it is held once a year. So, both these exams, what we have seen over last 2-3 years is the change is that they are still asking some one-liners, because factual information is also important to us. But more of it is now coming as integrated questions, right? So for example, what do I mean by integration? For example, if I have to ask you something from anatomy, I wouldn't really make it look like an anatomy question. I would make it look like a clinical question. To put it very simply, maybe I would ask it as a question of obstetrics. And I would say that, we are going to give an episiotomy. What muscles will be cut in it? Or all the following muscles would be cut except. So, we are basically asking you anatomy of the perineum, the perineal muscles. And that's how we frame the questions these days. So whether it is anatomy, whether it is physiology, whether it is biochemistry, yes. So they're also asking a lot of genetics these days, right? So whatever basic sciences it is, but they are being asked in a clinical format, which means you have to change your pattern of study from that of simply memorizing or rote learning to that of connecting the dots of basic sciences with clinical subjects. And that is what DAMS has been doing over last 1 year when the news of NEXT started to come. So our curriculum is also integrated. And if I put it across, how do we do it? So that, if you want to do it by yourself or if you want to be a part of DAMS, you should know what you're heading for and how you should study to make it more effective not only for your exams, but this is how you are going to see patients as well. A female patient does not necessarily mean she's going to come up with an obs-and-gynae query, right? So she could have a systemic manifestation of a local disease and vice versa. Yes. So that is why, when we would teach you in the class, whether it is first year tuitions or second year tuitions, or a foundation course, which is the third and fourth year subjects, or it is a regular course where it is all 19 subjects, we would actually teach you integrated. For example, in the first year tuitions, when you do anatomy, with every single aspect that the faculty tells you, they will tell you how the same thing would be asked in a clinical format. So we will frame questions for you. We will give you clinical case scenarios. We'll teach you how the patient presents in OPD, how the same patient can present as an emergency. And that is the art of learning that you have to do. It also makes medical science much more interesting, I think, for teachers as well. So for us, it is also far more interesting to teach you physiology in a connected way, rather than just giving you certain values to mug up. So what is the implication of respiratory changes in pregnancy? Or what is the implication of cardiovascular changes in pregnancy? And these are very, very important things, not because they're simply asked in the exams, but believe me, this is how the patient presents. So if you really don't know the physiological changes, for you, pregnancy would become a pathological condition. Not just pathological, in fact, probably a multi-organ failure, I would say, right? So whenever you are starting your studies, whether it is first year or second year or third and fourth year, please ensure that you are trying to do as much integration as possible, learning as much application as possible. That is the way forward. That is how medical education is evolving. And, you would see these changes even in your probably professional exams now, because the entire MBBS curriculum is changing from the year of entry of 2021 MBBS graduates. So integrated learning is the essence of medical education. Try and do it by yourself or with us in whatever way, but that is how you should be doing it. Yes. The third aspect that I want to put across of effective study in MBBS is something that I feel is a very, I would say basic thing, but often undervalued. And what is that? Whenever I study, whether I was studying for my MBBS or my post-graduation, or even for clearing my MRCOG exams or planning for my super specialization, I've always realized that if I don't give myself targets, then it is very difficult to, keep myself motivated. So whenever you sit and study, even if it is for as short duration as 1 hour, please give yourself well-defined targets. It's not just targets. For example, I don't want you to write down, okay, I'm going to read physiology today. Yes. So this is a very vague target. It's very vast and you will never be able to achieve it. The problem is if you make unrealistic targets, you are also unlikely to reach it. And therefore, it leaves you disheartened, it leaves you drained out, it leaves you with, probably no memory of what you have done. So always and always sit and study with well-defined targets. For example, if you have to even study for 1 hour, bacha, think or write down what exactly am I going to do in this 1 hour. If it's going to be physiology, specify. It's going to be cardiovascular system. If it's cardiovascular system, specify what exactly it is going to be. It is going to be arrhythmias. If it is arrhythmias, specify what exactly am I going to do. Am I going to do the pharmacology of it? Am I going to do the medicine aspect of it or patient presentation? Or am I going to read the core physiology of these circuits? Yes. So the more well-defined target you have during your study preparation, more likely you're going to achieve it and you are going to be happy about it. It will keep you motivated to give yourself yet another target and yet another target. So believe me, this way, even the shortest duration, even if it is like 1 hour, you will be really happy with what you've done. You will be able to recall it. You will be content that, okay, I finished one thing, and that itself brings a lot of happiness. Yes. So short, well-defined targets is the way to study, whether you study for short duration or whether you study for long duration. Okay. The next important point to make your study effective is giving yourself variation. Now, what do I mean by that? So, I think you all will resonate with me when I say that if I have to study, physiology the whole day or obs and gynae the whole day, it gets boring. Yes. So beyond certain time limit, let's say after 3 hours, I'm just with my books, but I really don't know what I'm reading. So when I say give yourself variation, what I mean is you can actually do 2 or 3 subjects in a day and do them integrated. For example, I will tell you how I used to study when I was doing my MBBS from Lady Harding. So if I was studying, let's say, medicine cardiovascular system, I would study for, let's say, 1 or 2 hours. And then when I feel saturated, I will actually switch over. I would say, okay, I'm done with medicine. It's too much for me now. So I switch over, but I'm still doing the cardiovascular system. But now I pick up pharmacology of it and study, let's say, the anti-arrhythmic drugs. So I did arrhythmias. And now in the next 2 hours, whenever that is going to be, I would do anti-arrhythmic drugs. And then when I get tired, I'm again going to do a switch over and maybe read the physiology of these circuits. So, this combines the 2 important points. 1 was integration. 2 was well-defined targets. 3 was giving yourself variation. This ensures that you are yourself learning to connect the dots. You are in touch with all subjects one by one. So, you never feel कि मुझे अब anatomy भूल गया या मुझे pharma भूल जा रहा है, because they are volatile things. They have to be done repeatedly. So give yourself variation in the day. And I would also say that right from, the year that you start your preparation for your entrance exams, please also get into a habit of solving some MCQs. So that's my next advice to make your study effective. Doing MCQs is not only important for your entrance exams, but I hope you know that most of the professional exams will also have a set of MCQ questions for you during your exams. So ensure कि आप शुरू से MCQ practice कर रहे हो. And again, give yourself short targets. So for example, you start with something like, I'm giving myself a challenge that I will do, at least 25 questions to begin with. So I'm not giving myself a very big target. It's a short target, only 25 MCQs, but I have to do it diligently, and I will do it every single day for next 7 days. Consistency. Remember the first thing I said is consistency. So, और ये MCQs भी कैसे करने हैं? You have to, start with MCQs of topics that you have read actively. So, for example, if you're reading, let's say, surgery with us, and you're reading GIT with us at DAMS, then when you get tired for 2 hours, after 2 hours, you can also switch over to do MCQs of GIT from DQB. So, in the DQB, you are given topic-wise MCQs. So, topic-wise, you start covering these MCQs. They are a form of reinforcement. You will be very happy when you're able to do it right, because then it shows that, okay, whatever you read, you're able to apply it as well in the format in which the exam is going to come. So start with MCQs right from the beginning. A lot of students do this mistake. Ki nahi, abhi I'm only going to read. I will do MCQs when I'm close to the exams. So don't do that, bacha. Do it right from the beginning. Give yourself a small number to begin with. Do it consistently for 7 days, and then increase your limit. So what do I mean by that? So if you have studied for, let's say, or 25 MCQs, you've kept your challenge and you've done that, 25 MCQs in a row for 7 days. Now you increase your limit. So now you challenge yourself and you say, okay, for my next week, the challenge is that I will solve at least 30 MCQs every day. And I'm going to do it consistently for next 7 days. So from 25, we move on to 30, and gradually we can move on to 50 as well. So MCQ practice, theory, they have to go hand in hand. You have to do them simultaneously so that you are doing the, I would say, hard work in the right direction. See, it is very important to understand that when we are pursuing MBBS, you are all very, very bright students. You're already the cream of the society, and you're going to compete with each other. Everybody knows that they have to work hard. So in the end, people who are able to do smart study, people who are able to do more focused study will turn out to do slightly better than the others, right? So you have to put your hard work in the right direction. Khali hard work nahi karna hai. Ensure that there is right direction, and that is precisely why we as faculty are here to guide you. You all can do hard work. You're very, very bright students. You can all get through. But when you take help of the faculty, you exactly know where to put the efforts. Your efforts are made a little easier, and your journey becomes faster. Yes? So it gets the acceleration, it gets the push in the right direction. So that is with respect to balancing notes and MCQs and how you should go about it. Then I think if I have to give you one more advice about how to make your study more effective, I would say that I want you all to reward yourself very frequently. This is something that you don't do. You are all very critical of your own performance, and you always think about so many negative aspects. Okay, I'm not bright enough, I'm an average student, or I am not from a very good medical college, and so on and so forth. So you put all these chains around your own self, and these chains limit you. Okay, so you have to break these barriers, you have to break these chains, you have to stop labeling yourself, and you have to start rewarding yourself. What do I mean by that? So throughout my talk, if you've listened to me, I said that you should, make short targets and sort of give yourself the well-defined targets. And once you achieve your target, what should you do then? So this is the point where you should reward yourself. Suppose you had decided that I am going to study for 2 hours, okay, and you managed it. You have managed 2 hours of study without distraction, with a lot of focus. Don't you deserve a reward? You do, yes? So please reward yourself. I want all you bachas to make a diary where you are going to write self-appraisal. Okay, every day you will write one good thing about yourself, because as you move forward in your journey, बहुत सारे self doubts आते हैं. Yes, and people will always try and pull you down. So this is the time when I want you to open this diary of self-appraisal, feel good about yourself, feel that you have all the abilities to do well and to be a winner, right? So every time when you achieve a target, reward yourself with something. It can be as short or as small as a chocolate. It could be something like, okay, some time with my friends. It could be something like a movie time over the weekend. So always reward yourself for targets well achieved. These are some of the ingredients that I think will definitely make your study effective. I also think not only it makes it effective, it makes it your study easier. So I have tried to divide it into certain essential points, which I believe are undervalued points. And if you take care of these things, believe me, it is not difficult to do anything that you have dreamt of. Yes. So maybe, go through the video again, jot down these things and put them into your system. These small things have bigger value and they will give you a bigger impact as well. Okay. I think this is going to be it from my side. I've tried to cover all the aspects that we should include if we want to study effectively in various aspects or various forms, whether it is your effectiveness as a doctor or effectiveness in your professional exams or effectiveness in your entrance exams. These things are common. You would need them at every place. And I hope you find the session effective as well. So if that's the key word for my session now. And I will keep next 5 minutes for any doubts that you have. I can see you all on the chat box. So if you have any queries that you want to ask me, please feel free to put them in the chat box. I will keep next 5 minutes to answer your queries if you have any. Else, I would just say that it was great to interact on this platform today, and I would like to thank Alicia for giving me this opportunity. I think this is a wonderful thing that Alicia has started. It brings students, faculties together. It also breaks this barrier where you feel that teachers are here and we are here. No, this is not the gap between the teacher and the students. This is where we are together. And once we are together, believe me, it is a symbiotic relationship. We are definitely going to do well in life. That's what we have to learn. And I wish you all the very best, everyone here in the chat box who's been a kind listener. So thank you so much, and my good wishes with each one of you. Thanks, Alicia.
Ma'am, thanks a lot for coming and accepting the invite to be a part of this conference.
My pleasure.
Well, it is an honor for us to actually have you here and discuss on various topics that are of importance to students and young doctors. So thanks a lot, and it was completely an honor to listen to you. And I'm listening for your session for the very first time, and it's very inspirational the way you tell students on how effectively you can work, and you can divide your time and how to concentrate, and how you can you have to be specified on what you are going to learn. So one question that we have here is we make timetables, but we do not follow them. So how to cope with this thing that we are already having a timetable, but we are not following it?
Yes, that's, Alicia, exactly what I tried to answer in my talk as well. So whenever you make a timetable, Rita, it's very essential that number one thing, it's a doable timetable. Sometimes you squeeze yourself with so many things that it is actually very difficult to match up. So don't think of yourself as superhumans. Start by giving yourself shorter targets. That's the key. So when you make timetable, initially make a relaxed timetable, and then the timetable should not be very broad. It has to be very specific. And the moment you do these two things, you will see that you're able to follow it, you're able to achieve it as well. And definitely reward yourself. Your mind gets trained. So अगली बार you अगर अभी 2 घंटे का timetable बनाया था, next time you'll be able to make a timetable of 4 hours. So you'll be stretching your limits, you'll be excited to do it, and you will do it. Yes, Alicia.
Yes, thank you so much, ma'am. And definitely your session entirely talked about this. And I hope students would get a good insight on how to prepare and plan their day, and also give a little bit of small rewards and stay happy, as Rika ma'am said in
you all deserve it, right? You all deserve it. You're already high achievers, and in order to achieve more, we have to keep reminding ourselves of the of the good things about our own self. You must remember that the first thing is appreciating your own self. Often we seek appreciation from a third person or from someone else, but that comes later. Only when you respect yourself, only when you appreciate your own self, will others see your light and they'll do the same.
Definitely. And we are really honored with your presence, and I congratulate you for the toppers that you got for the exam INICET. And
Yes.
I hope you keep on doing wonders and we keep on learning from you all the years along. Thank you so much for joining us today, and hope you have a great day and a great year ahead.
Thank you, Alicia. It was an absolute pleasure. And yes, the INICET results have been amazing for DAMS this year as well. So we pledge to continue doing the hard work and work together with these students and show them the direction. As I said, the hard work is yours. Thank you so much. Take care and best wishes.
Great. Thank you so much, ma'am.